All right, so if you're living with AFib, you know that someone maybe that you know someone is, or you just want to stay AFib free, this will be music to your ears. AFib is short for atrial fibrillation, by the way. Memorial Hospital is teaming up with the American Heart Association First Coast to offer free health screenings, interactive workshops, as well as education. Joining me now from Memorial Hospital is cardiac electrophysiologist Dr. Vora, as well as Debbie Stifler, who is Director of Cardiovascular Services. Good morning to both of you. Thank you for being here. Do appreciate it. Doc, let me start with you, because there are people who have always their whole lives probably been very healthy. I know people who are typically healthy, and they can all of a sudden have an AFib episode. What is atrial fibrillation? Well,
atrial fibrillation is one of the most common arrhythmias in the world. It's where the top chambers of the heart, the atria, no longer beat sort of in unison. Instead, they start quivering. And because of that, that leads the heart to do two things. One, it causes the heart to beat very irregularly, and it can beat very fast. Second, it also increases someone's risk for stroke, and that's sort of one of the biggest deals associated with it.
Let's talk a little bit, if we could, and Debbie, I know we're going to talk to you a little bit about the event, but I want to, for those of our viewers who are at home who think that this can't happen to you, the reality is you need to recognize the symptoms. And I know we showed them for you up on the screen, but let's break those down if we can a little bit. Because, you know, I have a family member that experienced this, healthy exercises, and it really started almost like with a low-grade fever and then night sweats. Right. And this can be subtle, and you don't realize you could confuse it maybe with a cold or maybe even a common flu.
Yes, that's true. Some people will actually be completely symptom-free, right, and the only way they'll get picked up is on a physical exam or an EKG. Others will describe chest pain, trouble breathing, the sensation of palpitations, getting lightheaded or dizzy, and one of the most common things I hear is fatigue, just lack of energy.
Is it important then, because I think that automatically, because people are going to assume, hey, I don't have any problems in my family, I'm just going to go to my general practitioner. You go to the general practitioner, it's important to give them these signs, because they can be subtle or you can be asymptomatic.
Oh, absolutely. I think getting your annual physical, if you're in atrial fibrillation at the time you're at your doctor's office, something as simple as a doctor listening to your heartbeat can pick it up. So it's very important to get screened if you're feeling any of these symptoms at all.
So, Debbie, let's talk a little bit about what this free screening then will offer to people who come in, because people think free and they're anything related to health, you know, and any kind of going to a hospital as an example can sound to them to be very expensive, but it isn't, obviously, because you want to reach out to the public, and there could be people who are out there now who, you know, are candidates for AFib, and this could really help them.
Absolutely. So we're working in conjunction with the American Heart Association, and we're putting on AFib Day, and it is tomorrow, and we're really excited about that. So it'll be from 9 to noon at Memorial Hospital, so we're hoping everybody can join us. We are going to have interactive workshops with the physicians. We're going to have giveaways and free screenings. We'll be doing some blood pressure screenings, BMI. We will be doing rhythm strips, which will be very exciting doing that. In addition to that, we'll have physicians that will be speaking on AFib, diabetes, obesity, sleep apnea, and also heart healthy eating. So we're really excited that that will give the community an opportunity to come out and ask questions, and also to learn out more about AFib.
For those who are watching who may be thinking about going to this, you want to encourage people to come and educate, and not necessarily to come with some other ailment that they're asking questions about, as an example, or specifically just related to heart questions?
Well, heart questions, of course, they can always ask. The physicians will be there, and they'll be able to, you know, answer questions. But our main focus, again, is looking at atrial fibrillation and really a holistic approach to treating heart disease. And that's why we're bringing in sleep apnea and talking about obesity and diabetes also.
Sleep apnea is something that can lead to AFib. It's interesting, too, because do you find that there are some people who maybe wouldn't want to come to this event because they're so afraid of what you might tell them? But the reality is AFib can be treated, and you can live a normal, regular life. You don't have to go in and have any kind of heart surgery necessarily.
Correct. I mean, AFib is definitely manageable. We have lots of different options. I think at Memorial we actually offer more different types of options in managing atrial fibrillation than anyone else in the region even. And so I think being afraid is the wrong thing. We need to get people treated. The main thing to do to protect anyone is protect them from stroke. Everything else is secondary in terms of making someone feel better, but the biggest thing is protecting someone from stroke. And so if you have it, we need to know about it, you need to know about it, and we need to get you on the right meds.
Get it fixed. Thank you both for being here. Do appreciate it. It's so important. So the free event, again, is tomorrow, 9 to noon. It's at Memorial Hospital. You can RSVP by calling the number here on your screen. It's 256-5724. But can they just show up, Debbie?
Absolutely.
You can just show up as well. We'll post this information with this interview on news4jax.com later this morning.